Hi, good afternoon. Thank you for joining us today for this workshop, Caregiving from a Distance. It's presented by Geriatric Care Managers Billie May and Debbie Kitchen with Aging Life Care Solutions and provided by Elder Care Work-Life Wellbeing at the University of Kentucky. Billie and Debbie, we're glad to have you here today. Would you like to introduce yourselves and get started?
Sure. Thanks for inviting us to do this presentation. My name's Billie May, and I am a registered nurse and have probably worked. We've done the geriatric care management, which we'll talk about in a little bit, for the last 10 to 12 years. And prior to that, Debbie and I worked together in hospital setting, and I did about 25 years in palliative care.
And this is Debbie, and I've been in acute care for about 36 years. And then part of that, I was the geriatric clinical nurse specialist for about 15 years.
And prior to starting our business, Debbie and I would talk frequently about the difficulty that our patients would have with navigating the system, our senior patients and the families. You know, and case management would come into their hospital room and say, okay, it's time to go home. And no one had helped them plan what that was going to look like, what was needed at home, how to be successful in staying out of the hospital. And so we started looking at what we could do to help. And so that kind of is what got us started in the aging life care business.
And just even our own parents, looking at as they got older, I was not in the same city that my mom and dad were in. And I was like, well, I'm not real sure what the services are there. So, that was very frustrating, trying to make calls myself. And with nursing background, that helped a little bit, but just to know what the resources were in that city, it was definitely a challenge. And I cannot imagine non-medical family members trying to understand where to even begin.
So we're going to talk about long distance caregiving and things that can be done to help make that a little more manageable. And then we're going to talk about geriatric care managers, which is what we do, and how that can be of benefit with some of those challenges. So long distance caregiving, it can mean that you live out of state from your family member, that you live across the country. We've even had clients that's families lived overseas, or you may just be an hour away, but still you're at a distance and you don't really know where to start when you're looking for solutions. So we're going to talk about some actions that can help make long distance caregiving more manageable.
What we always want to do is make sure that you discuss with your loved ones, what are their wishes? Mom, dad, do you want to stay home? What is it that you wish? So you need to have that up front, and you want to stay connected, because like maybe last week they said, well, I think I might need assisted living or something like that. Now, no, I think I want to stay home. So, just stay connected with what their needs are. Another thing that's a real challenge is communicating with the medical professionals. Who's out there? What professionals do they need? What resources exactly is it that they do need? When you do visit with your parent or sibling, whomever it is, be present with them. I know when you go for a visit, you've been out of town or you live out of town, you want to get things done, the house cleaned up, the groceries done, but just be present. Observe your family member. How are they getting around? Or I've noticed some changes with how they're thinking. How are they eating? How are they preparing their meals? Are they still driving? Looking at what are any safety issues within the home. Do they have grab bars? Do they have just anything safety wise that would help decrease the possibility of a fall?
One thing we have noticed over the years is frequently we will get calls around the holidays because maybe you talk to your family member and they say everything's fine. They sound good. They sound like everything's under control. You come in for the holidays or for a visit and you see that it is not the way, things are not going the way that they portrayed it to be. And so that's what Debbie said, be very observant of, is everything, check the things in the refrigerator. Is it molded? Are they expired? Do you see pots and pans that look as if they've been burned? Is the inside of the microwave black? Those kind of things will be clues that things are not going as well as maybe it's being communicated with you.
Yeah. And then you want to build a network of contacts around your loved one, whether that be a church, or it could be, what friends do they have that can be of an assistance?
Or are they isolated?
Yes.
Do they not have contact with anyone outside the home? Do they kind of almost like a hermit? Are they in the home pretty much all the time? Is anybody checking on them?
Yeah. And then looking at planning for the unexpected. Okay, you're not within that state. What is the plan if an emergency comes up? What if your loved one falls and breaks a hip? What plans are in place to address this, to take care of that emergency situation? Do they have advanced directives? Do they have a power of attorney? All of those things are very important to at least have an idea what you think you would want.
Do they have a primary care provider that they see, regularly? And kind of back up with communicate with medical professionals. Most facility hospitals in Lexington have, there's a medical portal that you can get an account and sign on, and you can see health information. And so is that a possibility that you could be added so you could access the portal so you can look and see, are they going to the emergency room or check labs or medications, things like that? That can be really helpful and easier than trying to get that information from a primary care provider's office.
Yeah.
And then an option, which is what we're going to be talking about predominantly the rest of the presentation, is consulting with an aging life care professional, and it's also known as a geriatric care manager. So what is an aging life care professional? The name geriatric care manager was used for many years, and probably about 8 or 9 years ago, the association, the Aging Life Care Association, rebranded this position as aging life care professional because it was a little more encompassing of everything we do. But it's also, it's a holistic, client-centered approach to caring for older adults or others facing ongoing health challenges.
Okay.
Next slide.
Next slide.
So what the aging life care professional can provide is expert guidance and coordination.
Basically, what we do is once we have a lot of times we will have a phone conversation with the adult child or whomever just to get an idea of what the need is. Then from there, if the loved one agrees, then we go to the home and we do a very in-depth evaluation, assessment of their medical, any medical issues, medications, surgeries, all of that, any emotional issues, any issues with activities of daily living or bathing themselves, cooking, etc. So we do a very in-depth evaluation, and then from there we develop a plan of care, and we discuss that with the loved one and with the client, and then we proceed on with that plan of care.
Another thing we do is coordinate care among doctors, therapists, and services. So we try to find out, the primary care physicians, are there any specialists? Do they get physical therapy, or have any other services, any home health or non-medical caregivers that come into the home, and make sure all of that care is coordinated.
Some examples that we have a client that she has no family. She has one relative that's out in Oregon, and we were found on the National Association by that individual. And she was living in an apartment, not safe. We coordinated Meals on Wheels. We took her to doctor's appointments. It just was not a safe situation. So we really worked a lot with the nephew. And then from there, we worked with some other individuals, and she is now in a very nice assisted living, safe. And we visit her once every 2 weeks or more if we have to. We still take her to her doctor's appointments so we can hear what they're saying. And, we're there with her, and then we report all of that back to the family.
One thing we do is in looking at, does this person need another level of care, is look at their finances.
Yes.
Because assisted living is so expensive that some people just can't afford it.
And memory care as well.
And memory care, is even more expensive. And so we try to look at what are options. Some are more expensive than others. We work with an agency that's what they do at no charge, actually, which is wonderful, no charge to the patient. And, what are the costs for the different facilities? Which ones are the most affordable, if that's possible? If that's not financially possible, then what other options are there? They're non-medical agencies that you could hire. Maybe they can get by with someone coming in for 4 or 5 hours, 2 or 3 times a week to help with bathing, do grocery shopping. So we really look at what they can afford, and what will meet their needs safely. Most people haven't, unless they've done this with other relatives, they haven't gone on this journey before. And so it's hard to know what to expect. Frequently, we find that families think there's either you live at home or you go to a nursing home, and there's nothing in between. And so we have to help them understand that there are other options and really work with them to see what's affordable, what will be safe to meet their needs. Because the system is not user-friendly, as most people know, if you've dealt with it at all. And we try to anticipate maybe not what's needed today, but what's going to be coming down the road, so that we're not caught by surprise and the family's not caught by surprise. So like Debbie said, based on our evaluation, we'll create a personalized care plan that looks at current needs. We make recommendations. We never tell anybody what they must do. And sometimes we'll have kind of decision points included in the care plan. For example, we might say, based on our current assessment, we feel like A, B, and C would be appropriate. But if you start to see this occurring, then we may need to step up to B, E, and F.
For example, we've got a client that is at home, a lot of medical issues, etc. We have coordinated. We've coordinated to get her care in the home. We also have coordinated with her physician to now get hospice. And before she could move back home, we coordinated with some individuals. This lady was a hoarder, and in order for her to be able to move back home, we got that all straightened out for her. And she has nobody at home or in Lexington or anywhere nearby.
She has no family.
No family at all. So we basically, we'll take you under the wing and do what we need to do to make that individual safe, meet their goals the best we can, and tweak it as need be.
In Lexington, we're very fortunate. There are a lot of resources in the community for our seniors, but it's hard to find them if you don't know where to look, and it takes a lot of time. So we can do that legwork for families and give them recommendations on resources that would be helpful. For example, Meals on Wheels. There's other meal services that can do home delivery. Non-medical needs, we can work with all the agents, can help range the best fit for that person if they need somebody to come in and help. There's people in town that do run errands. They would just go to the grocery store. Maybe somebody just needs a companion for a few hours once a week.
Also, we with some of our other clients, we noticed as we went in that there was very limited mobility. So along with the client and with that physician, we were able to get orders written for in-home physical therapy, occupational therapy, which was very helpful. Another thing that we really see is medications. They're not taking them correctly. We have worked with different resources that can really help that and make that so much safer for the individual so that they're getting their medications properly.
Yeah, that is a major issue. Because if you go to 2 or 3 different physicians, you may get medicines for 2 or 3 different physicians. And the communication between physicians is not always ideal. And we have found numerous times that the person maybe is taking medications that are the same medication. Maybe they look a little different because they're bottled differently, but they may be doubling up on things because they get them from different pharmacies or different physicians. So that is a major issue.
I mean, we have, depending on the individual, we have that when we do visit once a week. For some, we don't have to visit that often, that we have done their medications in their little, Monday through
sets
in their medication sets. And we'll set that up for the week. And we monitor that if it's determined that that's meeting the need. If not, we go to other resources.
Another thing that we try to focus on is support for family caregivers. That, being a caregiver is very stressful. It's probably the most stressful job you can have, because for a lot of people, it's 24/7 with no breaks. And so we try to help the caregiver find some time to take care of themselves.
And if you're long distance, that stress is horrible.
It's still there. You may not physically be there, but just the psychological stress. So sometimes by having a plan in place, that takes some of that stress away. And we can help connect people maybe with support groups that can help them talk to people that are going through similar situations. We help people, sometimes just making a decision and people don't really know what are the options. We have a client that's very involved with her mother's care and does a wonderful job, but she sometimes struggles with knowing what's the right thing to do. And I know I went through this with taking care of my father. even with a nursing background, you don't always know that you're doing the right thing. Maybe there's one thing I haven't thought of. Is there one more thing I can do? And so we help people sometimes just talking through the situation and what decisions there are to be made, what you might expect the outcome to be with each, decision takes a lot of that uncertainty away. And with this client, she frequently says that helps a lot, just talking through options and sometimes things that she doesn't think about, if you're hard to see the forest for the trees, if you're right in the middle of it.
You don't know what to do.
That we can give some options.
Yeah.
And just providing ongoing education. Like we said before, just helping people maybe understand the disease process. I think especially people with dementia, family members, that helps a lot just to understand that even though everybody who has dementia, their disease progresses differently, but to help kind of give them an overview of, yes, this is normal, kind of normalize some of the things they're seeing. So it helps it not be so stressful.
And we've got a client that's in memory care. He's got a very, very challenging behavioral dementia. And we went with the wife to the facility for a care conference and really discussed how the staff, what education the staff needs so that they can work with this individual better, safer, etc. So it's all different aspects of education that we can assist with.
And one of our main roles is to be an advocate for our clients and their families, and ideally avoid a crisis, but that's not always possible. And so we are always looking out for the best interests of the adult, and standing up for them, whether that means going to, care conferences in a facility or calling their primary care physician and advocating for them. We try to anticipate possible emergencies. That's not always possible, but we try to respond quickly and help support the family and support the client as things happen. Maybe as the disease evolves, things can change pretty quickly.
And one thing another thing, and I think we mentioned before, we have several clients whose family members live away, and one is in a long-term care facility that we visit weekly. They just want another set of eyes. We got the permission, the clearance that we can look at the medical records. We, just find out how they're doing. Then we report that back to the family or any issues that we see that may come up. And then we also see individuals on a weekly basis in assisted living, again, as another set of eyes, memory care, another set of eyes, open communication with the staff, any issues that we see.
So our main goal is to improve the quality of life for our clients, number one, and then for their families. So in that initial evaluation and ongoing is we try to help them identify their goals. What's their goals of care? What would help improve their quality of life? Frequently, the clients want to stay in their own home. And so we help, if at all possible, that we can help provide support so that they can do that. And we've had multiple clients that we were able to provide that support so they were able to stay in their home, maybe not long-term, but maybe 6 months, maybe a year, maybe a few weeks. But we try really hard to help them meet that goal. If we really feel like they need a little higher level of care, we'll work with them about what's available, what could they afford.
Basically, yeah, what is the next level of
Yeah.
care they need, and what's realistic?
We like to promote independence, helping
Mhm.
people be as independent as possible and maintain their dignity so that that helps their quality of life. So if there are staying in the home, I think Debbie had mentioned this earlier, maybe there's some modifications. Maybe they need a ramp. Maybe they need grab bars. Maybe they need a hospital bed, a walker, a wheelchair, a lift chair, anything that we feel like would help them be more functional. And try to explain, which sometimes is hard for people to understand, is if they can accept a little bit of help,
Mhm.
they can be independent longer and stay in their home longer. Maybe they have somebody come in and help them with the bath because it's really not safe for them to get in and out of the tub or in and out of the shower. But by doing that, they can stay in their home, decrease the risk of falls. And so we really look at safety is always number one.
And when we do see, for example, they need grab bars on certain areas of their shower, we don't say we're going to come in and put grab bars in here. We work with them, help them understand. And we've really never gotten any pushback at all. I mean, everyone is open. The client says, "Oh, yes, I understand that."
And we'll help them if they don't have a handywoman around. Then we'll help find somebody that can install those for them.
And it's definitely not Billie and I.
No. Isolation is a big problem, and loneliness in this patient population. And so we try to find out what kind of support system do they have and what is available in the community. Maybe going to the senior center, maybe their church. The one client that Debbie mentioned earlier that's living in assisted living now, going to church is very, very important to her. But obviously she's not able to drive, or where she lives, it's not in Lexington, so there's not, wheels kind of transportation, but connected to the church, the local church. And so they do provide, not every week, but
they come and get her, take her to the church. So we've had that open communication with their priest, and
they would bring communion to her if that's something she would want.
Yeah. And we've got, it's like, as far as with transportation, if the individual can say, go to the senior center, but they need transportation, we've got all of the resources as far as what are the different transportation agencies, or what transportation is out there, the costs, how it works, etc. So they don't have to worry about that. We can help with those resources and help arrange that.
So I know we talked a little bit about cost of assisted living and cost of caregivers in the home. It's all very expensive. And so we try to figure out what can they afford. And it may be their, we look at their insurance, Medicare. Some Advantage plans have some benefits for meal delivery. Maybe they have long-term care insurance that may provide some benefit to them. But we look at what can they afford. We would never recommend anything, obviously, that's not affordable to them. We try to help reduce unnecessary hospitalizations. Nobody wants to go to the hospital, and anticipate if they have some long-term chronic illnesses, are those well managed, communicating with their physicians to try to keep them out of the hospital. Hospitals are not good places for senior citizens. It can often make things worse. And so, and no one really wants to go to a nursing home. So trying to keep people out of long-term care if at all possible. sometimes if someone is in the hospital and they need some rehab
Mhm.
and they need to go to a rehab facility for a while, and we can work with that facility to help them know that the goal is to get back home. And so we've had really good luck working with therapists in the facility to get the person back to where they are able to go back home again, maybe with a few more support services in place. And then again, looking at their finances, their insurance plan, their, friends, family, how we can, it's kind of like a crossword puzzle, putting the pieces together to help support the person and maximize what benefits are available.
Because the one lady whose nephew lives out in Oregon, nobody knew. We knew she needed assisted living, but we did not know at all how much money she had. Her nephew did not know. So he flew in. We helped coordinate at her bank, and she's she has no real mental issues at all. No, she's cognitive.
She was agreeable to
yes,
this.
she was agreeable. So he is able now to, he sees what she has, he pays her bills, etc. So from knowing that, then Billie and I could move forward to finding her an assisted living. So it's rough sometimes.
So one thing that is a challenge is, what if the person does not want help? And frequently, especially with some cognitive changes, people may not have the insight to realize that they're not doing well. In their mind, they're doing fine. And so that makes it much more difficult. Sometimes we found that people will accept, they see us, as professional advice. So if we can come in and we try to keep it real low keyed and not pushy and bossy, but make suggestions, sometimes they'll take it better from us than maybe the family, because they still see their kids, they're their kids. They don't want their kids bossing them around. But that does add another layer of difficulty if people are not accepting of the benefits. I don't want anybody coming into my house.
Yeah,
we hear that a lot.
Yeah.
And so we just kind of have to meet the person where they are and take baby steps and work with trying to get some things in place.
And when we first visit and do our assessment after they've agreed that Billie and I can come in, what we try to do is really develop a personal relationship so that they don't feel like, oh, here's some medical people coming in. And we usually keep that first assessment evaluation done within an hour because we don't overload anyone. So, and it's amazing how much we can get in at that time to at least start that plan of care.
And one thing, just some advice, if you're have a family member that you're worried about, is if you talk to them, or try not to be, well, you need to do this, you need to do that, is express concern, but try to include that person in the discussion about, but there may be some things that will help make your life easier and help you live in your home a little bit longer. And I've heard of, some services that might be available. Is it okay if we get somebody to come and maybe give you some ideas? But it's, would totally be up to you. Hopefully that's something that you can kind of start out that way.
And a couple of times, the sick parent has some cognitive issues and they are just not wanting anybody to come in, and the family's like, they don't know what to do, but the parent really has a close bond with their primary care physician. So we have on occasion, with agreement with the family member, that their doctor has sent us, because your doctor wants you to be safe in your home, and he or she has asked us just to come and meet with you and see what we can do. And
That's work.
that's worked a few times. Yeah.
So, how to find an aging life professional. There's lots of different ways. One that a lot of people that contact us have used is the Aging Life Care Association, of which we're a member, has a website. And there is a lot of information on there just for the public. So I would recommend looking at that. But there is, I think it's kind of on the homepage in the top right, it says find an aging life care expert. And you put in your zip code, and then there's a drop down menu of the radius. Like if you want to find somebody within 10 miles, 20 miles. And so it will pull up people who are members of the association that geriatric care managers. It will have their information, usually a picture, the name of their agency, the phone number, the website. And so that is a really good way to find somebody. And then you can call and talk to them. Elder law attorneys. If you have an elder law attorney or your family member does, we work with a lot of elder law attorneys. And so they can maybe give you a recommendation of someone they've worked with that would be helpful. Professional colleagues, your colleagues or some corporations, businesses have as a benefit that they kind of an elder care benefit, kind of like a child care benefit, because we've talked with numerous companies around the nation that they offer that benefit. And so they can find someone. You might, if you call your benefits coordinator, HR, whoever handles that where you work, and they may be able to help you find an agency where your loved one lives that can give you some recommendations of people that can help. And then just talking to other families, a lot of the referrals we get are just word of mouth. Families may be talking in church. We know you had somebody that helped your mom. How did you find them? Can you give me their name?
And then we're also, there's several consortiums here in the Lexington area. That's great for networking. So that helps us to know, again, additionally, what resources are out there. And then we've got a lot of referrals from different professionals within that consortium that we have been able to help different family members and clients.
So resources, these are some, there's lots of things out there. Like we said, the Aging Life Care Association website. These are two excellent books, How to Care for Aging Parents and The Fragile Years. And they're both very good. Mm-hmm. You can get them on Amazon or probably in a bookstore. You may look, if your family member has some dementia, the Alzheimer's Association website is really good. There's lots and lots of information on that.
And Sanders Brown for the Aging in Lexington, they do a lot of different evaluations. They do a lot of seminars. But that's another good area to, click into to see what they've got going on.
And if you don't live in Lexington, look in your community. Is there a center for aging or some type of senior service that's available, particularly if you live in a city that has a university or a college? Mm-hmm. I see somebody had asked about who pays for our services. So we are private pay, and that probably is a barrier because some people, we try to work with our clients. We charge by the hour, but we are private pay. Some long-term care insurances will pay for us, and so that's good. Not a lot of people have that.
And not all of them are that good.
not all the policies are that good, but a lot of the policies will cover at least our evaluation.
Yeah.
And so we're happy to work with their insurance agency on that. Hopefully at some point, maybe, this service would be covered under Medicare. it is cost effective. We try to keep people out of hospitals, out of facilities that are so expensive.
Injuries, safety issues at home, medication management, just anything that can keep them from going to another facility that is so expensive.
So Debbie and Billie, there's a couple other questions here. Are you able to provide services for people who are outside of Lexington? My dad is in Ohio and I'm trying to coordinate care from Lexington.
We do not. We do Fayette County and the surrounding counties.
Can I, what you could do then is go onto the national site and type in your family member's area code, and then you will get a list of geriatric care managers within that area. Because actually I had a friend who lives here, but his sister lives up in northern Indiana, and I was able to I went into the site and I was able to give them resources as far as a geriatric care manager in that area, which was very helpful.
So, certain parts of the country are more accustomed to using geriatric care managers. I know that Cincinnati and pretty much all of Ohio, there are a fair number of care managers there.
We're the only ones here.
Yeah, there aren't many in Kentucky. Louisville has a few. And then the South, if you get like Atlanta, or Knoxville, Florida, of course, with their population has quite a few, but there aren't a lot in Central Kentucky.
Geriatric care
managers. But yeah, you can look on that website. It's really, will give you, because most will give you a list of people maybe in your area, and maybe they're not real close, but you can call and see if they may cover a pretty wide swath of the state.
And you could talk to a couple of them and maybe narrow it down, say, I kind of like what this individual says and all of that. Then go to the next step as far as setting up a meeting with them and all of that.
And most care managers that we have found, and we do this also, that first conversation is at no charge to kind of get an idea of what they need and do we think we can help meet their need.
There's another question. Assisted living is so expensive. What if that's not an option?
It is very expensive. And at least in this area, there are not any assisted livings that there's maybe an independent living that's subsidized, but there aren't any assisted livings that are subsidized. So we really look at what they can afford. Are they eligible for Medicaid? If they are eligible for Medicaid, we can try to help them and the families apply for Medicaid. The caveat is a long process, and who knows, how the benefits may change in the future. But sometimes, or if they have Medicaid, that there is a community waiver that can help pay for some care in the home. That might be, it might be
as of now.
That might be an option, is to look at what do they really need to keep them safe at the lowest cost. If they're in an unsafe situation and there is no money to pay for anything, long-term care may be the only option. Yeah. And so we really would work with them, the family, and the primary care provider, and because depending on their finances, if you're in long-term care and they can help you apply for Medicaid, that's different in each state. So I can only know a little bit about because it changes frequently, but that, sometimes that's the only option if somebody needs a lot of care and they have no financial resources to pay for it in their home.
Okay, are there any other questions? I'm going to ask a question regarding the fee. Is that like a monthly fee or a as we go fee, or how does that work?
Our fee,
Yeah,
our fee is hourly.
hourly. Okay.
So it depends on what we do. Sometimes people just need us to come in, do an assessment, develop a plan with resources, and that may be all they need. We've had people do that before, just anticipating they may have needs in the future. They wanted to meet us, start to develop a relationship, and then
we come in more active later down the road as that individual's needs are changing.
Because we have had people, we've done that, and then maybe a year or two later they call and say, well,
things have worsened.
Things have changed, and so we need you to do some of this. Sometimes people we will do an evaluation and they just need a phone call every few weeks. Sometimes we'll visit people weekly, and we'll give them an idea. We feel like usually our evaluations take about, in developing the plan, about 3 hours. And then we think they could benefit if we came in maybe every 2 weeks for about an hour. So we try to give people an idea of what the cost would be. But we do have, just a little contract, but they're not locked into, they have to hire us for 3 hours. I mean, 3 years or 3 hours or anything like that. It's just, we just found it easier to we just charge by the hour, and then based on what we do, that we can help them anticipate what the cost for our services would be.
Okay, that's all really great information. I think we've gotten a lot of good ideas here. I especially like the idea of thinking ahead before we're in a crisis mode. I think that's always a plus, no matter where our loved ones are living, but in this case, for sure. And being able to have those eyes, that extra set of eyes that someone at a distance isn't able to do, is really, really beneficial. So thank you, Billie and Debbie, for today.
Thank you.
And I'm going to stop the recording. Thank you.